Hey ladies, it's Andrea and Stephanie. She's with me today. I'm really excited to have her on because we are going to be chatting cold and flu season, which seems kind of crazy. I don't know, Stephanie, where you're at, but we are in 90-degree weather here in
Same.
Illinois. So, okay, yeah, fall is supposed to be here maybe tomorrow, so we're going to kind of count on that. But to think about cold and flu season seems a little bit odd, but I had both my kids that were sick last week, so it's definitely here. And I, for one, always have a ton of questions when cold and flu season happens. I always have to re-educate myself in terms of what I need to know with temperatures and medicines and dosage and all that, and I always have questions. So I'm really excited that you're hopping on, and no one's tuning in quite yet, but that's all right. If you join in live, go ahead and ask Stephanie your questions around cold and flu season, and if you're catching it on the replay, you can also ask your questions there, and Stephanie will get back to you. I leave the comments open for about 24 hours. You ask those questions if you couldn't catch us live, and then Stephanie will get back to you. So awesome perk of the group. So Stephanie, take it away. What do you have to educate us about cold and flu season?
Okay, so first of all, like you were saying, it's 90 degrees where I live, and it's 90 degrees across a lot of America, but the bugs and viruses and bacteria don't know the weather. It's cold and flu season when the flu vaccine starts to come out in late August all the way to basically March or April. And so definitely kids are going to start to come down with lots of viruses and bacteria. To start, I wanted to just sort of give some statistics. Kids get sick a lot, okay? So the younger you are, the more likely you are to have a cold. So kids who are kindergarten age will on average have about one cold a month, so up to 12 a year, which seems like a nightmare, and it is a nightmare, but it does get better. So as the older you get, the fewer colds you get. And so obviously adolescents and, older school age children only get about 2 a year, same sort of thing for adults. So kids, when they're little, get a lot of colds. And the other thing I wanted to sort of parse out in the beginning of the talk was to talk about viruses versus bacteria. So most colds, so things like cough, congestion, runny nose, are caused by viruses. There are tons of viruses out in the world. Things like influenza virus, RSV, hand, foot, and mouth, those are all viruses. And so unfortunately, the medical community has not come up with a way to really fight a virus in terms of curing it. So there is no cure for the common cold. It's sort of just part of the human experience. And we can do things to mitigate the symptoms of a cold, but we can't do anything to fix it or make it get better faster, except for there is a medication. If you do have flu that's tested positive by an actual flu test, there is a medication that you can get to sort of reduce the length of illness for the actual influenza virus, but that's the only medication that we have for a virus. And then things like bacteria, so things like a pneumonia that's caused by a bacteria, or ear infections that are caused by a bacteria. Sometimes sinus infections are caused by a bacteria. And so those things we can use antibiotics for, but in general, most things that come to the pediatrician's office are going to fall under the viral or cold category, and there isn't a medication that we can give right off the bat to help speed things along. And so the first other thing I wanted to mention was I'm going to talk about mostly older kids in this talk. Kids very newborn babies. So I consider newborn in the first month of life. Any fever in the first month of life, and a doctor considers a fever greater than 100.4 degrees Fahrenheit or 38 degrees Celsius. And that should be done certainly in an infant via a rectal thermometer, which I know no one wants to do, but that's really the gold standard. If you do have an axillary thermometer, then you need to add a full degree to that to get what we would consider a rectal temperature. So any fever, again, greater than 100.4, greater than 38 degrees Celsius in the first month of life is what we would consider a medical emergency. So that baby needs to actually I would bypass your pediatrician's office altogether and just go to the emergency department, because really there's a whole slew of tests that need to be done. They need to be put on IV antibiotics, and they will always be admitted in the first month of life to the hospital. And so beyond that, in the 2 to 3 month range, depending on some laboratory values that the baby would get in the emergency department, they may or may not be admitted to the hospital. But I would say anything less than 3 months, you can just take the baby right to the emergency department with a fever greater than 100.4. So the rest of the conversation I'm going to talk about would be 3 months and older. And so for older children, like I said, most symptoms of colds are things like cough, congestion, runny nose, and fever. And so again, same sort of thing. Fever in the medical community is always going to be greater than 100.4, greater than 38 degrees Celsius. A fever in and of itself does not mean that your child has a bacteria or that they have a viral process going on. It just means that their body is fighting the infection. So a fever, I always want to say, like, people in the medical community joke that we want to do PSAs on fevers, like public service announcements. Fevers are actually great things. It's your body's way of trying to fight the virus or fight the bacteria. And so a fever in and of itself is not harmful. It's actually like your body's way of trying to kill the organism that's making you sick. And so if a child is comfortable and has a fever, you don't have to medicate the fever by itself, because again, the fever is actually doing a good thing for your child. If your child is uncomfortable and has a fever, then you can go ahead and give them some Tylenol or ibuprofen. Tylenol would be for babies. You could start when they're basically through infancy all the way through adulthood, and ibuprofen we don't give to babies who are less than 6 months of age. Both of those medications, Tylenol and ibuprofen, are dosed based on weight. And so you can either call your pediatrician or just look on your last visit to your pediatrician what your child weighed, and it would have to be dosed according to their weight. And so again, fever in and of itself doesn't mean viral or bacterial and doesn't immediately necessitate like a trip to the doctor's office. I would say if a fever lasts between 48 to 72 hours, and you're not seeing any reduction in the fever, like the fever is consistently 102, the kid is not getting any better, that would be a reason to bring your child to that doctor's office. So fevers that aren't resolving are concerning for more of a bacterial process. So something that might require an antibiotic as opposed to just a virus, which your body is going to fight off on its own. And so the other important thing in pediatrics is respiratory issues, so difficulty breathing. Most kids end up in the hospital because of difficulty breathing. And so some ways that your doctor will evaluate if your child is having a difficult time breathing is by using what we say accessory respiratory muscles. So we look at your child just sort of on the exam table and we'll see, does this child look like they're, quote, working to breathe? Are they struggling to get air into their body? And so some ways that we just can physically look at your child and see that are they using their nose to breathe? So if they're flaring their nostrils in and out to sort of take in extra oxygen, that's a sign to me that your child is working to breathe. They're struggling to breathe. If they're sort of pulling in this little muscle, right here we call this tracheal tugging. So if they're sort of gasping for air there, that's also a sign to me that your child is working harder to breathe than they should. And then also if you pull up your baby's shirt, which I won't demonstrate for you, but if you pull up your baby's shirt and you sort of look at the area where their bottom of their ribs meets their tummy, and you notice that they're pulling in their tummy to breathe, that's also a sign to me that your child is working harder to breathe than they should. And so in general, when children are working hard to breathe, it still could be a viral process or it still could be a bacterial process. It's hard to say, but anytime a child is struggling to breathe, they should be evaluated by a doctor. And then we would listen with our stethoscope and take a listen to the sounds that the chest is making and see if it sounds more like a viral or bacterial process. And then sort of listen to the whole constellation of symptoms in the history and sort of make that clinical judgment. But anytime you see a child flaring their nose, pulling in their trachea area, or if they're using their ribs to breathe, then that's a sign to bring them in. Other things that kids struggle with when they're not feeling well and adults struggle with when they're not feeling well is just not wanting to eat. And so refusal to eat in and of itself is not a reason to bring your child to the doctor's office. Your child, I promise you, will not starve to death in 48 to 72 hours. But refusal to take in liquids is a reason to bring your child into the doctor's office. And so some people get sort of fixated on the idea, I have to get my kid to drink, 8 ounces of liquid every, hour, or they're going to end up, hospitalized or dehydrated or whatever. That's just not the case. If you can get your child, I always give families the lids of a Tylenol container where you would dose the Tylenol, so the tiny little 5 cc little cups, basically a little shot glass. If you can get your child to have one of those every 15 minutes, that would be sufficient. You don't have to get them to stuff themselves with water or get overly hydrated, because sometimes that makes them nauseous and makes them throw up. But if you can try to stay consistently on top of it with small amounts of liquid frequently, that's really helpful.
So when you're talking about liquid, are you talking water?
So it doesn't have to be necessarily water. The other thing I would recommend using would be Pedialyte. I would caution against using juices. If you want to use a juice, you could water down the juice. Juice in general, I'm not a juice fan. I think that juice has a lot of empty calories and basically very little nutritional value for humans in general, like adults and children alike. But I think juice, when kids are sick, sometimes they'll like guzzle it down, and juice has a very high sugar content and can actually cause diarrhea by drawing water into the intestines. And so sometimes juice sort of complicates the picture. So if you're going to give them juice, I would recommend watering it down. But if you can't get them to drink anything else and all they're willing to drink is like an apple juice, then that's fine. Just water it down. Kids are not the biggest fans of Pedialyte. I've tried it. It's not like great. It's like salty Gatorade. But you can get the Pedialyte popsicles. Sometimes that's a little bit more appealing to them, or popsicles in general might be a little bit more appealing to them. And then I would also sort of caution against, if your child is like over the age of 1 and is drinking milk, I would caution against using milk, because milk does produce more mucus and can make the phlegm and congestion a little bit worse. So water would be the best if they're willing to drink it, but if not, water, juice, and then Pedialyte. So then back to dehydration. So a way that you can sort of monitor whether or not you think your child is dehydrated would be to just basically try to think back as to how many times your kid usually goes to the bathroom. If they're still in diapers, how many wet diapers are you changing a day? Do you change 5, 6, 4, whatever your standard is? And sort of think, has today been a deviation from that? Have I only changed 2 wet diapers today? Have I not changed any wet diapers today? If you notice that you're changing 2 or more fewer wet diapers, or your child has gone to the bathroom 2 or more fewer times than usual, that would be a sign to your pediatrician that your child is dehydrated and should be a reason to come in for evaluation. And then other things, just sort of in general, no one feels good when they're sick. And so being cranky is part of the normal process of being ill. But if your child is what we would say inconsolable, so if your child cannot be comforted by any measure, you know, you've tried feeding, comforting, naps, hugs, kisses, drinks, and nothing will make him or her feel better, that's a sign that he or she should be evaluated by a pediatrician. When you're little, you know, things can happen where viruses can go into the blood-brain barrier, can cause things like meningitis. And so that's just always a sign to a pediatrician that something's wrong. Children are allowed to be fussy, but they should always be able to be calmed down by their main caregivers. And so if they can't be calmed down by you, they would want to be seen. And so those are the main symptoms. There's also cough, which can persist for some kids for quite some time. Cough in and of itself, again, is not a reason to bring your child to the pediatrician unless you notice that he or she is having difficulty using those muscles to breathe in between coughing fits, or is not being able to sleep because the coughing is so bad. If your child has a history of asthma, or if anybody in your family has a history of asthma and is having a really bad cough, that also would be probably a reason to be seen by a pediatrician. But cough in and of itself is not necessarily a reason. And coughs in colds can last, unfortunately, up to like 4 weeks. So sometimes coughs linger. It's definitely the symptom of a cold that lasts the longest and can be really frustrating to families and parents. But if it's gradually getting better over the days and weeks, you don't necessarily have to see somebody. And then I was going to talk about just sort of remedies and what I would recommend to feel better. So we talked about the hydration. We talked about Tylenol and ibuprofen. So Tylenol, again, you can give to babies all the way up through adulthood, and ibuprofen after the age of 6 months. They're dosed based on weight. And then in general, like your smaller babies, so less than 3 months, those babies who I said were really like an exception to all of the rules. I wouldn't give them Tylenol because we would want to know if they have a fever, because it's a big deal in the medical community for babies to have fever. And then I think it's important to mention that the American Academy of Pediatrics actually does not recommend any over-the-counter cold or flu medications for any children less than 6 years of age. Over-the-counter cold and flu medications have a fairly aggressive side effect profile, and they've been studied by the American Academy of Pediatrics, and they really haven't been shown to be better than placebo in that age group, and they're expensive. And so we just don't recommend them for those children at all. Does somebody say examples of over-the-counter? So anything like Zarabees, Delsum, any over-the-counter like cough or cold suppressant, we just don't recommend at all. And so other things I would recommend. So I'd recommend all families, like the moment you find out you're pregnant, you should just go ahead and buy a humidifier because your child is going to be sick like at some point in the first year of life, and you'd want to have it before they get sick. So you're just like prepared. As far as like cold or hot humidifiers come both in cold or hot humidified air. I recommend when you have a smaller baby, so a child who eventually is going to be pulling down cords, and when you're going to have to baby-proof the house, you don't want to have to be worried that you have this hot air humidifier that they could potentially pull down a hot bucket of water onto them. So until your child is older, I wouldn't get a hot air humidifier. I would just get the cold air mister humidifier to have in your house. Children actually respond really well to those and can really help moisten the mucous membranes and make the runny nose and cough a lot better. And then for just sort of decongesting the nose, most children until they're around preschool age don't have the ability to blow their nose out for themselves. So you have to help them, being the loving parent that you are. So I recommend, I love the Nose Frida. I hope that like everyone has one. I think it should be like on everyone's baby registry. It's just like the greatest invention ever. If you don't have the Nose Frida, which is essentially like this little tiny device that you put inside your child's nose, and then you put a tip in your mouth and you suction back with your mouth the mucus in your child's nose. There's like a barrier so you can't get any of their boogers in your mouth, but it's just like a really great suction device. If you don't have that, you can just use sort of that blue bulb suction that they sent you home with from the hospital the day that your child was born. That also works very well. But I want to caution parents against being like really aggressive with the bulb suctioning, because sometimes parents get like obsessed by removing boogers out of their kid's nose, and then all of a sudden, like after so many times you're putting this device inside your tiny child's nose, it will actually get swollen, and your child's nose will just become like even more congested because the actual tissue itself is now irritated and damaged. So I would say like, 4 times a day you could use a bulb suction or the nasal Frida, but I wouldn't get more aggressive than that. And then as far as a cough, if a child is greater than 1 year of age, you can use honey as a cough suppressant. It's actually been studied and it's actually quite effective in children greater than 1 year of age. Anybody less than 1 year of age, there's actually a risk of developing botulism with the use of honey, so we don't recommend it for anybody less than 1. But when they're greater than 1, you can definitely use it. It's very effective. You just literally give them like a spoonful of honey, and it really is a great cough suppressant. So yeah, like I was saying, most kids that come to the pediatrician's office with symptoms of like fever, cough, congestion, runny nose, it's normally just a cold and doesn't actually require any antibiotics at all. Reasons to bring them in are the work of breathing, fever greater than 72 hours, if they're refusing to stay hydrated, if you notice a drop off in their urine, either from diapers or a number of trips to the bathroom. And then if you just have any concerns, your pediatrician like has no problem seeing you or hearing from you 24 hours a day. I promise you that's why they went into this. They're happy to help. They're happy to reassure you over the phone or see you guys in the office. As far as people often ask, like, when is it okay for my kid to go back to school? Mm-hmm. I generally say that your child is safe to go back to school if they've been fever-free for 24 hours. Like I said, the coughs can last up to 4 weeks, and runny noses can last usually 7 to 10 days. And so we don't have to wait for like all of those symptoms to resolve. But if your child has been fever-free and is feeling well enough to go back to school or to daycare, you can send them back into class. Otherwise, let's see, what else did I want to mention? The flu vaccine is out. It's been out in California since August. If your child is 6 months of age or older, they can go ahead and get it. The first time you get the flu vaccine, you get 2 vaccines. You'll get one as your first one, and then about a month later, you'll get your second one. And then after that, you can get it just annually for the rest of your life, really. And other things, so I just wanted to touch on GI bugs as well, since a lot of kids will end up with diarrhea or vomiting sometime in the winter. Although I have to tell you that in pediatrics, the summer is the most often time you'll see vomiting and diarrhea, and then in the winter, you'll more often see the respiratory problems with cough, congestion, runny nose. But anytime your child has a GI bug, you just want to basically make sure that they're staying hydrated. So all those tips I told you about for the respiratory issues with staying hydrated, same things apply for tummy bugs. Usually tummy viruses just last 24 hours. If your child is unable to keep down any hydration in those small little sips, then that would be a sign to come in to see your pediatrician sooner rather than later. But in general, they just last 24 hours. You don't have to be aggressive about trying to get them to eat. Again, no child's going to starve in 24 to 48 hours, just basically watching their hydration status. Otherwise, that's pretty much it. Those are all the questions I had.
Cool.
Yeah.
I've got one question that came in earlier that I'm going to go ahead and show. So Erica wants to know the difference between cough and runny nose being an actual cold or allergies, and is there a way to know the difference?
Okay. So there's not like a great way for you guys at home to tell the difference. I will tell you, generally speaking, that cough and runny nose related to allergies will generally produce a clear runny nose and a pretty mild cough. The cough will generally be worse when your child is like laying back to sleep at night because we'll have some postnasal drip. Sometimes people come into the office and they'll be like, my kid's boogers are green or they're yellow. And that doesn't really tell us if it's a viral or bacterial process. Sometimes they're like convinced it's bacterial because their boogers are green. And really all that tells us is the amount of time that's like boogers have been in your child's nose. It doesn't mean that it's a viral or bacterial process at all. But I will say true allergic rhinitis, so true runny nose related to allergies, is always clear. So if you're having clear runny nose, that's a sign. And if the cough is worse when your child's laying back to sleep. And then a cough or runny nose related to allergies should never be accompanied by a fever. And children may feel unwell, but certainly not as unwell as they would feel if they had a true cold.
Okay, perfect. And then I see somebody that is joining us live. So if you are watching us, say hello. And if you have any questions, now's the time. You've got Stephanie. So use her knowledge if you have any questions. Otherwise, I certainly have a few. And hopefully it'll kind of be broad enough for everyone to take advantage of. But you were talking about the different types of thermometers and uses, and rectal is obviously the best, especially when they're younger. And I never had a problem with that when they're babies, but obviously as they get older, they hate it. So you were talking about like adding a degree. So I don't know the difference between like underarm or in the mouth or the ones that swipe across your. Can you give me kind of a lowdown on like, do you actually take what's on the screen on all of those, or when do you add, or all of that?
So the only time in really your entire, in a human's entire life that a fever needs to be so precisely diagnosed is in that first 3 months of life. So it's truly like a medical emergency if a child has a fever of greater than 100.4 in the 3 month or less range. And so that's when we take it like, you know, verbatim. It has to be an exact measurement. Otherwise, I think, you know, if your child's like 5 months, 6 months, and you're using a swipe across the forehead or an axillary under the arm or under the tongue thermometer, I would take that as sufficient. But in the less than 3 month range, we like have to know what the true core temperature of the child is. And so that's why we do the rectal thermometer.
All right, perfect. We got another question.
So not over-the-counter allergy meds. So this is over-the-counter cold and flu medication. So things that contain cough suppressants, things that contain Sudafed, things like that. Allergy medications, so things like Zyrtec and Allegra, those are fine. This is just over-the-counter cough and cold medications.
Nice. Okay, cool. Let's see. Another question I had is, this is personal to my daughter, I guess, but sometimes when she runs a fever, she doesn't run a fever. Is that normal? Like she will be on fire to the touch, and then I take her temperature and I don't get a reading normal. Like, but she's cranking and showing all these other signs of having a fever. Does that happen?
I mean, it can happen. I would say sometimes kids like feel the worst as they're like about to spike a fever. A fever is only as accurate as when you take the exact measurement, and unfortunately we can't like have a constant thermometer on our, fortunately or unfortunately, we don't have a constant thermometer on our children. And so it's only as good as the moment in time that you take it. And so it can certainly happen. If the kids are exhibiting other signs or symptoms that they're not feeling well and they're febrile to the touch, I think that's certainly accurate. And actually, like, moms are very good at telling whether or not a child has the fever just by feeling them. So.
Yeah, that's kind of what I've been relying on is if she's on fire, then clearly there's something wrong. But a couple times it was very perplexing because I would take her temperature and it wouldn't be high. So that's super odd to me. So what about, I hear moms in some mom groups asking if they should wake up their children in the middle of the night to give them like another round of medicine. And I would assume based on what you said before, not to, because if their body needs to fight it, and if they're not uncomfortable, that's okay. But what is your thoughts on that?
if your child's like on a prescribed antibiotic and they have a true bacterial infection, then you have to wake them up to give them medication. If you're waking them up to give them something like Tylenol or ibuprofen, I wouldn't. So if your kid is sleeping, they're comfortable enough to be getting some rest, I would just let it ride out. Again, the fever is your body's way of protecting themselves and trying to fight off the illness. And so I don't think you have to actually physically wake your child up.
Okay, great. And then what would you say is the most common thing that kids will be coming in for? Is it the cough, fever, or what's usually the number one thing that you're seeing?
I would say people most often bring their kids in for fever. I mean, fever to families is scary. And I think that they're, it's like a true objective marker that you can have at home that says like, my kid is not feeling well, which is why we always joke, like, we have to do this public service announcement to tell people that fevers are good. But a fever in and of itself is not that worrisome. If the fever persists, if your child is really not doing well, if they're inconsolable, if they have a bunch of other symptoms, like they're not eating or not sleeping and not drinking, those are signs to be concerned. But a fever in and of itself in a happy child is not a reason to come in.
So you mentioned for newborns to 3 months, 100.4, take them in. Anything above that? So is there any type of threshold like that for older kids where it's like 120, take them in? But is there anything like that?
I would say there's no in the medical community, the only true time in a human's entire life where that's like the exact rule to be taken into the emergency department is in that 3-month time period. But I would say, like, to me, when your child has a fever of like greater than 102.5, that's the real fever. Certainly like 104, those are real fevers. But again, there are no like hard and fast rules. Like a fever of 104 means that a child has a bacterial illness, and a fever of 102 means that they have a virus. There's never been any study to demonstrate like the height of a fever correlates with the likelihood of having a viral or bacterial process. So I think that if your child is persistently having fevers for several days that are really high, that's the reason to come in. But one time or times, not necessarily.
Okay, perfect. I wanted to see if you wanted to chat about preventative care. I mean, we hear washing our hands a lot. What else can we be doing as parents to help prevent it to begin with?
It's tough, and people ask this all the time. The truth of the matter is like cough, congestion, runny nose, upper respiratory infections are just like part of the human experience, and it does get better every time you get a cold. Like I said, there are hundreds of colds in our environment, and every time you get a cold, you actually don't ever get that specific cold again. Your body develops antibodies to that specific virus, which is why as you get older, you get fewer and fewer colds. So I try to think of it as like, a child is developmentally capable and ready to take care of and fight these infections, and it's part of the growing up process. It's part of developing antibodies to be a super healthy and strong adolescent and adult. And so you can wash hands, good hand hygiene, but there's really nothing else. You don't have to walk around with masks and all this kind of stuff. Kids are going to be kids. Kids get sick, and that's really all you can do.
So we can at least take note that even though it may be a struggle for the first few years, that
better
in the next few years, that's a good thing.
You're basically paying it forward. You're suffering for a better adolescence.
Perfect. Okay. So I think, Jen, you're still on. If you have any last minute questions, throw them in here. Otherwise, I think we're going to wrap it up for today. So again, if you're going to catch us on the replay, go ahead and throw your comments in here. I will be monitoring it, and then I'll let Stephanie know, and she will definitely get back to you. So I'll leave comments open for 24 hours, and you can jump in there. And the reason why I'm doing it for 24 hours is Stephanie has a life outside of this group, so she can't be coming in here every 2 seconds and looking at this thread for months and months. So you have 24 hours to get your comments, and if you weren't able to catch the replay or catch us live, so no worries. If you're on the replay, just throw your Stephanie will get back to you. All right, I think that's all the comments I see. So Stephanie, thank you so much for joining us today. We will talk to you next month.
All right, bye guys.
All right, bye.